Good morning, friends. Suswagatam. You are all welcome to Saspandan TCM Academy. Friends, today's subject is very different. Very few teachers, very few healers are discussing on this subject. Premature ejaculation. Because this subject is secret. People are not discussing. About 30% of populations, people are suffering with the premature ejaculation. It is a known figure, but unknown figure may be high because who is suffering with that is not telling his problem because of shame. बहुत लोगों को ये प्रॉब्लम है, बहुत लोग इससे पीड़ित है, प्रीमेच्योर इजैकुलेशन. वो शर्म की वजह से सामने नहीं आते, इवन डॉक्टर को भी नहीं बता सकते बिकॉज ऑफ शेम. इससे for that their self-esteem will be disturbed. Their relationship will be disturbed with their partner. Relationship also disturbed. So they can't able to satisfy to their partner in the bed. ये प्रॉब्लम से बहुत लोगों का आत्मविश्वास हो जाता है, बहुत लोगों की ये नाते संबंध अपने पार्टनर के साथ बिगड़ जाते हैं. ये सोसाइटी में बहुत बड़ा प्रॉब्लम है. दिस इज द वेरी बिग प्रॉब्लम इन द सोसाइटी because of our wrong lifestyle. So nowadays, youngsters are not sleeping in time. Nowadays, youngsters are eating junk food. Nowadays, youngsters are following the social media. There are many porn videos are coming in the social media on the YouTube. So many reasons their energy is getting disturbed. तो यह है प्रीमेच्योर इजैकुलेशन. सबसे बड़ा शत्रु है और ये एवरी डे एवरी ईयर ऑल ओवर द वर्ल्ड ये बढ़ते जा रहे हैं. इट इज इंक्रीजिंग ऑल ओवर द वर्ल्ड. Okay, so friends, let us discuss. So, what is the premature ejaculation? It is the uncontrolled ejaculation, uncontrolled, uncontrolled ejaculation and low sperm count. Premature ejaculation or uncontrolled ejaculation can arise when there is either not enough chi. So we are discussing this premature ejaculation through TCM. So we are the TCM worker, we are acupuncturist. Okay, so we are discussing this premature ejaculation in TCM. So premature ejaculation or uncontrolled ejaculation can arise when there is either not enough chi and yang to hold the semen back, or too much yang in the form of heat. There is a lot of heat, too much yang in the form of heat, which drive the semen outward. अभी इसका हिंदी में बात करेंगे. अनियंत्रित स्खलन, अनियंत्रित स्खलन और कम शुक्राणु. शीघ्र पतन या अनियंत्रित स्खलन तब उत्पन्न हो सकता है जब या तो वीर्य को रोकने के लिए पर्याप्त प्राण शक्ति और यांग नहीं होता है, या गर्मी के रूप में बहुत अधिक यांग होता है जो वीर्य को बाहर की ओर ले जाता है. Okay, so too much yang can be excess or deficient condition. Too much, when there is the too much yang, it is the too much heat. So heat will be, when too much heat, it will be consumed the yin. Okay, too much heat is the excess. Okay, so then it will be consumed the yin. Traditionally, sperm quality was not something that could that be quantitatively measured. पुराने जमाने में ऐसा, जब अभी जो समझ में नहीं था स्पर्म, जो ये तो बहुत सालों साल पुराना प्रॉब्लम है. It is an ancient problem, premature ejaculation. So people are unaware about this reason. The only thing that could be observed was the consistently color, quality of semen by combination of the modern analytical technique and traditional knowledge. Okay, तो बहुत अधिक यांग एक अतिरिक्त या कमी की स्थिति हो सकती है. बहुत अधिक यांग एक अतिरिक्त और कमी की स्थिति हो सकती है. परंपरागत रूप से शुक्राणु की गुणवत्ता ऐसी चीज नहीं थी जिसे मात्रात्मक रूप से मापा जा सके. केवल एक चीज जो देखी जा सकती थी वह आधुनिक विश्लेषणात्मक तकनीकों और पारंपरिक ज्ञान के संयोजन से वीर्य की स्थिरता, रंग और मात्रा थी. Okay, understood? Is it easy to understand? Please reply me in the chat box. Is it easy to understand? Okay. Okay. Now it is a very complex subject. So let us go slowly so that you can understand this subject. Okay. Now it is now possible to differentiate the related imbalance. Imbalance pattern when diagnosing poor sperm quality. Kidney zinc, understand, kidney zinc, it is the kidney essence. Kidney zinc deficiency, and in some case, blood stagnation can manifest with the low blood stagnation. Sorry, in case of blood stagnation can manifest with the low sperm count because of kidney essence deficiency and blood stagnation can manifest with the low sperm count, sperm that are abnormal, sperm that are abnormal, or sperm that have the short lifespan. So short lifespan, so that sperm not useful in conceiving. तो खराब शुक्राणु गुणवत्ता का निदान करते समय संबंधित असंतुलन पैटर्न में अंतर करना अब संभव है. किडनी जिंक, किडनी सेंस, किडनी जिंक की कमी और कुछ मामलों में रक्त का ठहराव, ब्लड स्टैग्नेशन, कम शुक्राणु संख्या, असामान्य शुक्राणु या कम जीवन काल वाले शुक्राणु के रूप में प्रकट हो सकता है. Kidney yang deficiency can manifest with the poor sperm motility. Thin and watery seminal fluid can also be sign of kidney yang deficiency in TCM. Thin, patla, thin and watery seminal fluid can also be a sign of kidney yang deficiency. Seminal fluid that is thick. Secondly, okay, seminal fluid that is thick and sticky is more typical of dampness, especially damp heat. When there is the damp heat in the lower burner, damp heat in the in the lower burner, that seminal fluid that is the thick and sticky. Okay. किडनी यांग की कमी खराब शुक्राणु गतिशीलता के साथ प्रकट हो सकती है. पतला और पानी जैसा वीर्य भी किडनी यांग की कमी का संकेत हो सकता है. वीर्य द्रव जो गाढ़ा और चिपचिपा होता है, जो गाढ़ा वीर्य द्रव गाढ़ा है और चिपचिपा होता है, वह डैम्पनेस, विशेषकर डैम्प हीट की अधिक विशेषता है। फ्रेंड्स, damp heat can be also make seminal fluid yellowish or too acidic. अगर seminal fluid अगर yellowish होता है, this is a diagnosis, you have to note down. Okay, अगर seminal fluid अगर yellowish होता है, yellowish and acidic होता है, okay, so जब ejaculation होता है seminal fluid, हाँ, और वो अगर इसमें पेनिस में अगर जलन पैदा करता है तो दैट इज एसिडिक सेमिनल फ्लूइड। ओके, सो ये बिकॉज ऑफ डैम्प हीट कैन आल्सो मेक द सेमिनल फ्लूइड येलोइश और टू एसिडिक। Premature ejaculation is usually related to a kidney pattern and especially kidney chi is not firm. When there is no kidney chi firm, so premature ejaculation is related to this kidney pattern. It also may be due to heart pattern, such as a heart chi or heart blood deficiency. When there is the heart pattern, it is because of heart chi or heart blood deficiency. डैम्प हीट, ये जो डैम्प हीट ये भी वीर्य को पीला या अत्यधिक अम्लीय बना सकती है। शीघ्र पतन आमतौर पर किडनी पैटर्न से संबंधित होता है और विशेष रूप से किडनी ची फर्म नहीं होती है। यह हृदय पैटर्न जैसे हृदय ची या हृदय की रक्त की कमी के कारण भी हो सकती है। हार्ट ची डिफिशियंसी एंड heart blood deficiency. Now, the premature ejaculation, dripping of uterine, that is worse. Sorry, dripping of urine, dripping of urine, that is worse after sex. There may be also clear frequent urination, weak steam urination, incontinence of the urination, urine रुकता नहीं, urgency of urination, soreness and weakness of the lower back. Lower back में weakness रहेगा, soreness रहेगा. There may be weakness, tiredness, dragging down, feeling in the lower abdomen. Okay, it is a bearing down. ऐसा पेट नीचे आया हुआ ऐसा लगेगा. Feeling cold, cold limbs, दोनों हाथ और पैर में कोल्डनेस लगेगा और टंग अगर देखेंगे तो टंग पेल लगेगी एंड pulse will be deep and weak. The acupuncture points, so अगर ये symptoms है, ये patterns है, तो acupuncture points bladder 23, REN 4 and DU4. If kidney chi is not formed. Bladder 23, REN 4 and DU4. Okay, let us see the location of this point. See, this is the bladder 23. Can you see? Okay. Bladder 23, UB 23. Location UB 23. It is a 1.5 tune. 1.5 tune. Two finger. 1.5 tune. Lateral to the side में, lateral to the lower border of the spinous process of the second lumbar vertebrae. Okay. L2 के नीचे, L2 के नीचे जो उसका जो स्पाइनस प्रोसेस है, इट इज द उससे 1.5 चून लैटरल जाना है, साइड में जाना है. ये लोकेशन है. सी दिस 1.5 चून lateral. Okay. Now, how to locate this point? Let us see the video. ये देखो नंबर 2. Don't insert deep needle. ओके, ये पॉइंट में डीप निडलिंग नहीं करना है, या ऑब्लिकली. ओके, टुवर्ड द चैनल फ्लो. ओके, टोनिफाई दिस पॉइंट. Tonification means toward the channel flow. Now let us discuss the rain pore, location of the rain pore. Rain, it is the same channel, it is the consumption vessels. This is the rain pore. See, below the navel. Okay, is the rain pore. On the midline of lower abdomen, 3 tune inferior to the umbilicus and 2 tune superior to the pubic symphysis. Okay, 3 tune means 4 fingers of patient, not your. 4 fingers of patient. This is the 3 tune. Come down 3 tune from the navel, from the umbilicus. Okay, this is the location of the rain pore, CV4. Okay, let us see the how to locate. 3 चुन नीचे आओ, या पब्लिक बोन से 2 चुन ऊपर जाओ. See how to locate. Okay, now let us see the DU4 governing vessels. Governing GV4 or DU4. It is a Ming Man. Ming Man. This is the Ming Man. Okay. So location of the Ming Man on the midline of the lower back. In the depression below the spinous process of the second lumbar vertebrae. Okay, below the spinous process of the second lumbar vertebrae. You don't go for this point, don't go lateral, on the midline, below the spinous process of the second lumbar vertebrae. Now, how to look at? See, okay. So this was about the 3-point location. Now let us move ahead. Now second patterns of this problem premature ejaculation, spleen and heart yang deficiency. Spleen and heart yang deficiency. There may be premature ejaculation, poor appetite. With these symptoms, patient will be suffer with the poor appetite, slight abdominal distension after eating, tiredness. Patient will be getting tired. What do you pour? Vijay Kumar ji, just I showed the DU4, and so it is the tonification. Again, UB23, DU4, and REN4, all 3 points are tonification. Okay, so tonification means toward the channel flow, meridian flow. So there, let us discuss the second pattern for the premature ejaculation. So there may be premature ejaculation with the poor appetite, slight abdominal distension after eating, tiredness, lassitude, and pale complexion. The complexion, its face will be pale, weakness of the limb. Okay, loose stool will be loose. Okay, loose motion, feeling cold limbs, edema, palpitation in the chest. Okay, shortness of the breath on exertion. Okay, when exertion, there will be shortness of the base and spontaneous sweating, continuous sweating, and a slight feeling of discomfort or stuffiness in the heart region, pale and wet tongue. Tongue will be pale and some moisturized, wet tongue, and a deep, weak pulse. Now here the protocol of acupuncture point. REN 12, HT36, spleen 6, bladder 20, heart 5, bladder 15, and REN 15. Take a note, write down this protocol. When there is the spleen and heart young deficiency, REN 12, HT36, spleen 6, bladder 20, heart 5, heart 15, REN 15, and give moksha to all points. Okay. प्लीहा मीन्स स्प्लीन, प्लीहा एंड हृदय यांग की कमी, उससे क्या है, शीघ्र पतन के साथ भूख की कमी, खाने के बाद हल्का पेट फूलना, थकान, सुस्ती, फीका चेहरा, हाथ और पैर की कमजोरी, पतले दस्त, ठंड ठंड लगना, ठंडे अंग, ओके, सूजन, घबराहट, परिश्रम करने पर सांस की तकलीफ हो सकती है, हो पसीना आना, हृदय क्षेत्र में असुविधा या जकड़न की हल्की अनुभूति, पीली और गीली जीभ और गहरी कमजोर नाड़ी। ओके, ये एक्यूपंक्चर बिंदु है। रेन 12, HT36, स्प्लीन 6, यूबी 20, हार्ट 5, यूबी 15, रेन 15, और सब पॉइंट्स को मोक्ष देना है। ओके, अभी हम एक एक पॉइंट्स पे का लोकेशन देखेंगे। रेन 12, this is the REN 12. It is the fortune above the umbilicus. Fortune, नेवल से चार चार चून ऊपर, चार चून means 3 and 3, 6 finger, go to 6 finger up. Fortune above the navel. On the midline of the abdomen, fortune above the umbilicus, and midway between the umbilicus and the sternocostal angle. It is the when sternum bone end, and the navel take the middle of these two. Okay. Now let us see the video how to locate this point and how to insert the needle. Not playing. Ah. See how to locate. Take a midline, midpoint of the sternocostal sternum, GP sternum, and navel. Okay. Now our next point is the ST36. Next point is ST36. Jusan Lee, ST36. See, this is the ST36. And location is the below the knee, okay, kneecap, okay. Take the location of the lower border of the kneecap. And from kneecap, go 3 tune inferior down, okay. 3 tune go lower, and to it is a ST35 there at the level of the lower border of the patella, lower border of the kneecap. There is a one depression you can feel. It is the ST35. And from ST35, go lower 3 tune, means 4 finger. And 1 finger breathe lateral to the anterior crest of the tibia. और टिबिया बोल से एक फिंगर, एक इंडेक्स फिंगर लेना है और 1 finger breath of the crest of the tibia. Okay, so this is the location of the ST36. See, this is the ST36. Now let us see how to locate the ST36. Hero. Okay, now let us see the next point. Our next point is the spleen 6, SP6. This is the SP6. See, locate the medial malleolus, tip of the medial malleolus, prominence of the medial malleolus. This is the medial malleolus. And go 3 tune up. Go 3 tune up from the medial malleolus. Okay, this is the ankle bone. This is the medial malleolus. Go 3 tune up to the medial malleolus, and this is the at this location. This is the SP6 point. Okay, see, on the medial side of the lower leg, 3 tune superior to the prominence of the medial malleolus in the depression close to the medial crest of the tibia. Okay, this is the SP6. Now see the video how to locate the SP6. Okay, Now let's discuss. Let us see our next point, UB20. Bladder 20. Our next point is the bladder 20. See the bladder 20. See, now location, bladder 20 location is the 1.5 tune. 1.5 tune lateral to the lower border of the spinous process of the 11 thoracic vertebra. Okay, we have the 12 thoracic vertebra. Count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11. 11 thoracic vertebra. Okay, so these are the thoracic vertebra. This is the 11 thoracic vertebra. Okay, so locate this point 1.5 tune lateral to the lower border of the spinous process of the 11 thoracic vertebra. Do finger, sorry, 1.5 tune, 2 finger, you have to go the laterally. Okay, this is the UB20. Let us see the video how to locate the UB20 and how to needle the UB20. Okay, let us move to other point, heart 5. Heart 5. This is the Leo connecting point of the heart channel. Okay, see the heart 5. It is a 1 tune proximal toward the elbow. 1 tune proximal from the wrist. See the proper location. On the radial side of the tendon, so first feel the tendons, radial side of the tendons of the flexor carpi ulnaris, and 1 tune proximal to the H7, heart 7, on the wrist, line. Okay, okay, go 1 tune proximal from the wrist. So let us see the video how to locate heart 5. Okay. One thing, heart pie is a very good point for aphasia, speech disorder. Heart pie. Our next point is the UB15. It is the backshoe point of the heart. UB15. See the UB15 here. Okay. This is the location of the UB15. It is the 1.52 lateral to the lower border of the spinous process of the fifth thoracic vertebrae. Count fifth thoracic from the up. Thoracic 1, 2, 3, 4, and 5. And come on the fifth thoracic vertebrae and come to the lower border of the spinous process of the fifth thoracic vertebrae and go 1.52 lateral from there. This is the location of the heart 15. Okay, see the video how to locate the heart 15 and how to needle the heart 15. This is a very even best point for the heart blood deficiency. Heart blood deficiency, UV15. Now our next point is the RN15. This is also the Leo connecting point of the conception vessels. RN15. See the RN15. Yeah, it is a on the midline of the abdomen, 7 tune above the umbilicus and 1 tune below the level of the sternocostal angle. When sternum bone ending go down 1 tune, only 1 tune, one thumb breadth. Okay, that is the location of the REN 15. This is the REN 15. See the video. How to locate the REN 15. Don't insert deeply, perpendicularly. Don't insert the toward the heart. This is very contraindicated. Okay, and these all points, RAN 12, HT36, SP6, UB20, Heart 5, UB15 and RAN 15 give moxa. सबको मोक्सा दे दो, मोक्सा का हिट दे दो. Okay. Our next pattern. Our next pattern, when we are dealing with the premature ejaculation, our next pattern is the damp heat in the liver channel. Damp heat in the liver channel. There may be premature ejaculation, burning on the urination. When some person is going to urinate, then he is suffering the burning on the urination. Urinary difficulties also, and urine is dark urine. Genital, popular or vesicular skin rashes. Popular or vesicular rashes and itching. Fullness of the hypochondrium, abdomen or hypogastrium. There may be bitter taste in the mouth, bitter taste because of liver fire. Okay. Nausea, feeling of vomiting, and feeling of heaviness of the body. Tongue will be red with the redder sides. Okay. And sticky yellow coating, and on the tongue there will be coating, sticky yellow coating, and pulse will be slippery and wiry and rapid. So in this case, when this patterns is appear in the patient with the premature ejaculation, points are liver 2, note down, liver 2, RAN 12, RAN 9, spleen 9, LI 11, RAN 5, and RAN 3. Again, I am repeating acupuncture points. RAN 2, sorry, liver 2, RAN 12, RAN 9, spleen 9, LI 11, RAN 5, and RAN 3. All points sedate. Sedate all points. Sedation means against the meridian flow. Your needle should be against the meridian flow. Sedation. लिवर चैनल में अगर डैम्प हीट रहेगा, डैम्प हीट, शीघ्र पतन, पेशाब में जलन, मूत्र में कठिनाई, गहरे रंग का मूत्र, जननांग में पॉपुलर मीन्स लिंग पर छोटे छोटे उभार या धब्बे आना, छोटे छोटे उभार आते, धब्बे आते लिंग पर, पेनिस पर, या वेसिकुलर त्वचा पर चकते और खुजली, हाइपोकॉन्ड्रियम पेट या हाइपोगैस्ट्रियम में ब्लोटिंग जैसा, ओके, कड़वा स्वाद, मतली, कमजोरी, कमजोरी महसूस हो सकती है, शरीर में भारीपन, जीभ लाल दिखेगी और किनारे में अधिक लाल, और छिपी चिपचिपी पीली कोटिंग दिखेगी, पीली परत दिखेगी और नाड़ी फिसलती हुई दिखेगी और फिसलन भरी और तेज होगी, रैपिड। तो उसके एक्यूपंक्चर बिंदु है लीवर 2, रेन 12, रेन 9, SP9, L11, रेन 5 एंड रेन 3। अभी हम एक एक पॉइंट्स के लोकेशन देखेंगे। अपना पहला पॉइंट है लीवर 2। See, this is the liver 2. Okay. Location on the dorsum of the foot between the first and second toes. First and second toes, and 0.5 chun proximal from the margin of the web. Okay. This is the margin of the web and go to the 0.5 chun proximal. This is the location of the liver 2. And liver 2 is the fire point of the liver meridian. Okay. Now see the video how to locate the liver 2. Okay. Our next point is the REN 12. We already seen the REN 12. Now we move to the REN 9. REN 9. Okay. This is the one chun above the umbilicus. नाभि से एक चुन ऊपर. See, on the midline of the abdomen, one chun above the umbilicus and 7 chun below the sternocostal angle. Okay, this is the location of the REN 9. See the location video. Now, our next point is the SP9, spleen 9. See, this is the spleen 9 at the medial of the foot. Okay, on the medial side of the lower leg, in the depression in the angle formed by the medial condyle of the tibia. This is the medial condyle. This is the condyle where the tibia bone. This is the tibia head, medial tibia head. Okay, medial condyle of the tibia and the posterior border of the tibia. This is the posterior border of the tibia. This is the location of the spleen 9 video. Okay, our next point is the 11. See, this is the 11. When you semiflex the video, or our semiflex the elbow, the lateral end of the elbow crease, lateral end of the elbow crease, like this. Can you see lateral end of the elbow crease? Okay. See the lateral end of the elbow crease. How to locate? See the video. Okay. Our next point is the REN 5. See this REN 5. Two chun below the navel, two chun below the umbilicus, REN 5. Okay. On the midline of the lower abdomen, two chun inferior to the umbilicus, two chun below the umbilicus, and three chun superior above the pubic symphysis, pubic bone. Okay, this is the location of the REN 5. See the video. Our next point is the REN 3. REN 3. REN 3 is the one chun above the pubic symphysis. One chun above the pubic bone. Okay, one chun above the pubic bone. Okay, on the midline of the lower abdomen, four chun inferior to the umbilicus and one chun superior to the pubic symphysis. Okay, or you count down your 6 finger, four chun, 6 finger from the umbilicus, go down. There is the location of the REN 3, or one finger thumb breadth above the pubic symphysis. See the video, how to locate. Okay, now one important thing I want to tell you when we are dealing with the premature ejaculation, heart chi descending, if heart chi descending, play a role in the ejaculation. Therefore, premature ejaculation may be due to heart chi deficiency. For this reason, I treated a heart and the kidney also. So, हार्ट की डिसेंट स्खलन में एक भूमिका निभाता है, इसलिए शीघ्र पतन हार्ट की कमी के कारण हो सकता है। इसी कारण से मैं हृदय और गुर्दे का इलाज यही पैटर्न से करता हूं। और फ्रेंड्स, वन थिंग आई एम टेलिंग यू, फ्रॉम मंडे, कमिंग मंडे, डे आफ्टर टुमारो, so I am taking the special course for the dealing with the paralysis, wind stroke. Dealing with the paralysis, you can treat any type of paralysis, even in patient is going to coma. You can treat that patient. You can reverse that paralysis. There are the conditions, how old paralysis it is, but overall, it is very beneficial acupuncture treatment. So I am going to teach in this course. This course will be up to 1 month period. 1 month. It is a Monday, Tuesday, and Wednesday in the week. 3 days in the week. If you are interested, if you are willing to learn, if you are interacting with any paralysis patient in your relation, in your neighbor, okay, you can make the miracle with this course, with this treatment. If someone have to learn, please message me. I will, okay. This course is starting from day after tomorrow, from Monday. Timing is the 6 p.m. to 8 p.m. 6 p.m. to 8 p.m. Okay. And about the any male or female gynecology, any problem in the gynecology, male or female. So in TCM, in acupuncture, it is very easy to treat. Okay. Many infertility treatment I have treated successfully. So I will announce the free course as well as paid course in the groups. Those who are interested, you can follow me. Okay. Thank you very much. Enough for today. And one thing, I am thinking every Saturday, I am coming online with the free course. Something I'm going to teach you. Okay. Thank you very much. closing the session.